Right, Dr. Shruti Malik, do you think it will be prudent, it would be wise to just look at what's happening in Kerala in silos? Could this also be an indication that it is the beginning of the third wave and it's only a matter of time, Dr. Shruti Malik, that it spreads to the rest of the country as well? Let's not look at Kerala as being a state which is battling COVID-19. There is still travel going on outside from Kerala and into Kerala as well. And that is something which other states have also not really taken very seriously, because if the third wave does come, then in retrospect, we will be blaming Kerala for it.
Vineet, you're very right. It could be the start of the third wave. See, we first need to understand that it's a respiratory virus. Now, the spread of the virus is not in our control. The virus is going to spread at its own pace. What we can do is we need to sacrifice all our rituals and pleasures and stop all sorts of super spreading events right now. And thirdly, the most important thing is still, though we have vaccinated almost 66 crore people, but the vaccination of rest of the population is very, very important. Today, a study came in the Lancet journal that stated that there was a study in the second wave that was done that people who had long illnesses in the second wave for about 28 days or more, it was less for people who actually got both the jabs, who were vaccinated with both the doses. It was almost half for them. So now you can actually understand the importance of vaccination. And moreover, I'm more concerned for India, because if we see developed nations like US, where in the last week of August also they had 105% more number of cases, and they are also seeing a spike in the cases for children under the age of 12 years. Now, if that happens in country like India, where we are already opening the schools, where children are almost having lot of symptoms, though we have achieved sort of a herd immunity when we talk about children, almost 50% of the kids have already been infected and had infected themselves in the last wave. But if we see the numbers in the coming time, it's not only the COVID, it's also the MISCs that the children got infected with. So all these points are very, very concerning. So if we really want, we should have the state-wise epidemiological team who should guide us. Even ICMR said that such kind of data should be told to the states so that they can take a proper guidance and a call as to how they have to function individually and not as a country as a whole.
Concluding comments from the rest of the panelists, starting with Dr. Shruti and Dr. Rao. Dr. Shruti.
See, I completely agree with what Dr. Bagai said. This is the right time where we need to stop the politics and take care and stop all sorts of, the super spreading events, all sorts of events that can lead to a lot more cases, not only in Kerala, but in rest of the states. And testing has to be a priority, because we do not want such kinds of more states to come up, and that could be very, very terrible for India. So people should follow COVID appropriate behavior, which they aren't doing it. We should be following a lot more of COVID appropriate behavior, and side by side, the vaccination speed should increase at a more faster pace.
Okay, Dr.